Arlington. Senator Favola.
Thank you, Mr. President. I'd like to speak to the amendment.
Senator has the floor.
Thank you, Mr. President. I do want to thank my colleagues who have worked so hard on the Finance Committee. I believe you approached your job with good faith and good intentions. I do, however, believe that it is time that we support the amendment offered by my colleague from Northern Fairfax. Whenever you put together a budget, we know that we should look at potential revenues coming in, as well as looking at the efficiency and effectiveness of each and every program. It is our responsibility as good stewards to give our taxpayers a very good value for their programs. It is also our responsibility to respond when Virginians are in need. Ladies and gentlemen, for the last 4 years, we have lost $2.9 billion each biennium because we did not participate in Medicaid expansion. Now, there's a very important human component to this, but there's also an economic and jobs opportunity, and that's a component to this. We have lost an opportunity to create thousands of jobs for hardworking Virginians. And these jobs pay good money, and they have benefits. For example, a medical billing clerk can earn $35,000 a year. A medical assistant can earn $19 an hour. A clinical assistant can earn $14.50. These are jobs that individuals can be trained to do in a fairly short period of time and create access to health care while they're doing it. Guess what? Jobs grow the economy. Isn't that what we've all been talking about? That's been a value we've all espoused at some point or another. Let's move to the human component of Medicaid expansion. Those hardworking Virginians, for a family of three, for example, earning between $10,524 and $28,000 a year, cannot get health coverage, and they cannot go to a doctor when they're sick. In my mind, these hardworking individuals should really have the dignity of being able to access health care for them and their families when they need it. Because we're not willing to make this structural change to our health care system, we are continuing to put our hospitals under stress. We're continuing to put our other providers under stress. We're, in fact, encouraging our healthcare system to be less sustainable and less able to provide quality of care to all of us. We had a large discussion this past session over slowing the rate of increase in insurance premiums. I remind the senators that the states which enjoyed the slowest increase in rate premium growth were states that expanded Medicaid. The time has come. Every major group in the Commonwealth, from business groups, the Virginia Chamber of Commerce, to faith groups, to hospitals, to all kinds of groups who care about their communities and chose to be organized, have come to us and asked us to act. How can we not act? I think there are very compelling reasons to act. Medicaid expansion could provide coverage for 1,000 individuals in Patrick County, for example, or 2,900 individuals in Rockingham County, or 10,600 individuals in the city of Virginia Beach, or 10,800 individuals in Henrico County. There are real people out there who need us to act. I will close by giving you one example, and this is just one example of the 400,000 people who would be eligible to benefit from Medicaid expansion. This individual is Margaret Lipford, and I read about her in the Danville Register and Bee. Margaret worked for 3 decades at the Dan River Mills, and she paid into Social Security and Medicare. However, the mill closed in 2006, and just as Mrs. Lipford was diagnosed with lung cancer, her doctors told her she needed care. She didn't qualify for Medicaid. She was not old enough for Medicare, and private insurance would not cover her. She was left with a diagnosis of lung cancer and no insurance. She pieced together care by accepting charity care at different providers and hospitals. But she's asking, and she asked very publicly, that we act. She doesn't understand why somebody like her, who has worked hard her entire life and now needs to access care, cannot do it, and yet lawmakers in Richmond have not yet acted. Well, ladies and gentlemen, today I'm going to stand with Margaret Lipford. As much as I respect the work that my colleagues have done and acknowledge there are many good things in this budget is significantly flawed, and I simply cannot support this budget or the Senate Budget 30 as we move forward without Medicaid expansion. Thank you so much.
Thank the senator.